Are you ready to embrace aging with vitality and purpose? Welcome to Essential Wellness, the podcast dedicated to empowering women to live their best lives at any and every age. Join us as we explore the secrets to living and aging well with insightful conversations on health, wellness, and finding meaning, purpose, and passion in midlife and beyond. I'm your host, Dr. Mikel Segal. Let's dive in. Okay, hi everyone and welcome. I'm very excited. Today we have Dr. Melinda Lacerna calling in from Florida, and she is a plastic surgeon practicing in Florida. And welcome, Melinda.
Hello.
Hi. Maybe you could share with the listeners a little bit more about yourself and what you do so they can get to know you.
Yes, so I love my career. I'm a board certified plastic surgeon. I've been practicing for 20 years. So, yes, I'm really old, but I love aesthetics. I'm specializing in facial aesthetics, facelifts, and skincare, but also a lot of minimally invasive surgical techniques, as well as a lot of non-surgical techniques, and pretty much just healthy living and a balanced life and work balance kind of is very, very important for me. So eating well and exercising and being very passionate about your career and your family.
All good stuff, things
Yes.
that we love to talk about.
Yes, exactly.
What maybe you could share with the audience how you got to doing what you're doing now and just sort of your path to becoming a plastic surgeon and doing what you do.
Yes. So I came out of high school wanting to be a dentist initially. And then I heard about Smile Train when the plastic surgeons go abroad and do mission trips for cleft lip and palates. And that's how I got inspired to go into plastic surgery. So I did my training at Temple University in Philadelphia. Graduated in 2005, and I'm initially from Southern California. But about 14 years ago, we moved here to follow my trauma surgeon husband because he was starting a trauma program at the local hospitals. And we've been here since then. It was a very difficult move because back then my son was 18 months old. So it was really a challenge moving the practice, starting over, not knowing anybody, and having a little toddler with you and keeping your marriage together and all that. And I had to start the practice from zero. So that was a challenge too. And being in a different state, Florida is very different culturally and geographically from California.
Yeah.
So that was all a challenge, but we got through that, and my family loves it here. So we've done pretty well, I think.
How did you get through the challenge? What sort of things did you do to?
A lot of exercising and a lot of just forming new connections. One thing, forming new friends that are very like-minded, both outside and inside of medicine. Number one, and number two, and just having a passion project. I really wanted to move back to California, but when I started building my practice from scratch, it became a passion project. Soon I was like building something again. And I think that really got me through it. And then in a blink of an eye, it's 14 years later. And here we are with a very busy, successful practice.
Amazing. Yeah. So just kind of focusing on what you love to do and
Yeah.
in terms of your work.
Yes, exactly.
Very cool. So what you said you focus on facial.
Yes, on facial plastic surgery. And that was an evolution too. I started my career doing a lot of breast reconstruction for post-mastectomy for breast cancer patients. And then it just kind of evolves, like about when I turned 50, I had an aha moment about my career. I really figured out I love the technicality and artistry of facelifts because every facelift is different. There's no two same techniques. There's a lot of artistry to it. What I try to do differently is I use my patients' younger photos and I try to reestablish that again. So I copy what they used to look like and not so they don't look like somebody else. And so that's kind of the secret to very natural results. And so that kind of ignited my passion for my career again, like really finding what I love in my field.
Yeah, amazing. Sounds like it's funny because you mentioned that you started off wanting to go into plastic surgery because of the cleft
Yes,
palates.
yes,
So that started things, but then you ended up doing more breast reconstruction. And
yes.
now you've moved back to the face, but in a different
And,
way.
yes, exactly. Like in our own career, we also evolve and we
Mm.
figure out what we love, because we change internally too, and we change mentally. And so, also getting older, like I can relate more to postmenopausal women now because I'm also 5 years postmenopausal. So
Yeah.
I totally understand now where they're coming from and what their concerns are. As I get older, like I'm shifting focuses as well. Yeah.
Yeah, that makes sense. Tell me a little bit more about facial plastic surgery and your approach. And I mean, you mentioned a bit about how you approach it.
I developed my own technique where it's not just about the facelift, all about cutting like most surgeons are focused on, but I've also incorporated a lot of regenerative medicine, such as fat grafting, using the patient's own PRP, and of course, the buzzword of the century, exosomes. And in addition to that, I really focus on the skin. So when we look at ourselves when we were younger, it's not like we're pulled tight or overdone, but we had beautiful skin and we look softer. So that's kind of the approach. If you just kind of rely on just the facelift pulling and cutting, you're going to have unnatural two pulled results. But with the combination of regenerative therapy and really focusing on beautiful skin, I'm able to produce facelift results that are very natural and it looks like my patients, but just 15 to 20 years younger.
That sounds good.
Yes.
Can you explain more about the PRP and the
Yes. So,
exosomes and how you
yes.
use them in
it-
your
yes. So, PRP, or platelet rich plasma, we obtain a component of the patient's blood and we centrifuge it and we isolate it's the golden portion of the tube, so it's separated from the red blood cells and the white blood cells. So we're isolating the plasma. It has all of our own growth factors, and so I use that in combination therapy with the patient's own fat grafting. So fat grafting also has adipose derived stem cells. We can't say too much stem cells because of the FDA, but that's essentially what they are. So
Mhm.
we're building back or bringing back all of the regenerative properties back to the face that
Mhm.
has slowed down after menopause. In addition, speaking of menopause, did you know that we lose 30% of our collagen just after menopause? And
Yes, I've
so,
heard that stat. That's pretty
yes, so it's
shocking.
terrible. So when we take estrogen rich areas of the body, especially those areas we want to get rid of, areas that women hate, such as the lower belly, the inner thighs, the outer thighs, those are also the estrogen rich areas or fat cells. So when we bring them back to the face, they reintroduce, improve collagen synthesis again. So
Mm.
that's really fascinating. And exosomes are also extremely fascinating. So all of our cells have exosomes. They start as intracellular products within the cell that the cell excretes, becomes an extracellular product, and it becomes how cells communicate to each other. So the
Mhm.
biggest thing in aesthetics now is the uh, dermal fibroblast derived mesenchymal stem cells. They produce exosomes, and these are available now for skincare products, for topical applications, etc. So we're finding a lot more about these products, how efficacious they are and how safe they are.
Okay, yeah. So I want to go back to the exosomes in a second, but just going back to the fat grafting. So
Yes,
are you actually you're actually taking fat from different parts of
yes,
woman's body,
yes.
then you're grafting it onto the face. Is that right? Or
Yes, exactly. Fat graft grafting has been around for a very long time. It started out being utilized again for breast cancer patients.
Mm-hmm.
Because when the tissue has been radiated, it causes a lot of fibrosis in the skin and in the tissue around the breast. So we started using fat grafting to soften the tissue in the area and to improve the quality of the radiated skin. Because of all of those things we just said, bringing back stem cells, allowing the body to heal and regenerate itself. So then this application has been expanded. Everyone's heard of Brazilian butt lifts. So it's the same thing. Brazilian butt lifts or BBLs. We take unwanted fat from unwanted areas. We put them to good use. We put them in the gluteal area to improve the volume and the shape of this area. So it's also done for no breast implant, breast enhancement. This is wonderful. Women don't necessarily have to have breast implants anymore because it's silicone, and there's a lot of fear out there with breast implant related illnesses. Now we have an option for women. We can do fat grafting, again taking fat from areas that where they don't want it, such as saddlebags, inner thighs, lower belly, upper belly. Love handles is a good area, and we bring it where we want it. So it's the same concept with the face, pretty much.
Very cool. Okay, so you're doing the fat grafting, and then how are you using so just to go over with the exosomes, the cell sends out these signals,
Yes.
signaling like small molecules.
Yes.
Then they're collected. Those are the exosomes, and then they're collected and used in a way to produce whatever results you want. Is that
That's
right?
absolutely
Yeah.
right. So currently there's different exosomes that are this pretty much endless possibility. There's donated human tissue from placenta that are ethically obtained by these companies. And then they obtain the exosomes, and in the lab, they replicate these proteins to be able to produce kind of pretty much billions of them per like 5 cc. So each different company, there's different volumes or cell counts for these exosomes. There's also the lyophilized kind, which is like the powder form, which is more temperature stable, that you reconstitute kind of like you would reconstitute Botox. Like if you get your Botox, you get it in the powder protein form and you reconstitute it with bacteriostatic saline. So it's similar with these lyophilized exosomes. So what's available right now are the human-derived exosomes. There's plant-derived exosomes that are also fascinating, because now we're also finding that there's a lot of similarities between human DNA, plant DNA, and animal DNA. We all like start from the pluripotent stem cells, and then we kind of all differentiate, but the bases of the DNA are very similar. There's a lot of studies now that show, and products out there about plant exosomes, so which is a good vegan alternative.
I guess so. So how are you using the exosomes right
Yeah,
now?
so because I do a lot of deep resurfacing with plasma called Renuvion or a Neogen nitrogen plasma. It's very similar to lasers, like if you get a really deep laser treatment, but even deeper. So we get amazing results with these, but then it's a prolonged downtime. So what I do is I use the exosomes topically immediately after the treatment. And when I compared my series of before I started using exosomes, maybe 5 years ago, to my series after I started using exosomes 2 years ago, I compared the time to reepithelialization, or their new skin growing, and I have found that in my series, it's decreased it by about 30%. And they have less pain because there's an anti-inflammatory pathway to the exosome healing. So it really decreases their pain, their inflammation, their redness, and pretty much because it's decreased the rate to reepithelialization, all the other possible complications are decreased, such as bacterial infections, viral infections, fungal infections, because you build up the skin barrier right away, which is our protective barrier.
Mm.
So it really is fascinating.
Wow. Okay. So it helps speed up the healing and
Yes,
reduce complications.
yes, exactly, exactly.
And is that treatment that you're mentioning that you mentioned, is that do you do that along with the facelift, or this is a separate treatment
Yes, so it
together?
can be done at the same time as the facelift, or it could be done as a separate from a facelift. So, for example, women or patient or men, a lot of men go through this too.
Mhm.
They don't want a facelift or a neck lift, but they want better skin, more rejuvenated look, but they don't want any incisions. Then we do this deep plasma resurfacing, and they pretty much have facelift results without incisions or scars. So
Wow.
it's pretty
And you
fast.
mentioned there is a downtime to this deep plasma research.
Yes. So the downtime is about 2 weeks,
Two
but
weeks.
we can tailor it. I have another plasma that's more tunable. So
Hmm.
it's safe for all skin types, Fitzpatrick 1 to 6,
Hmm.
versus the other deep resurfacing is more lighter skin tones, Fitzpatrick 1 to 3. And this nitrogen plasma can be used head to toe, even for the body. And you could do like a light plasma peel, like a lunchtime plasma peel with no downtime, or
Mm.
you could do a medium depth plasma peel. You would probably need about 3 treatments a month apart, and that's about a 3-day downtime. Then you can do the deeper nitrogen plasma peel with about a 7-day downtime. So
Oh,
it's very tunable. And they actually won the best menopause device in the United Kingdom. So it's pretty cool.
oh,
Yeah.
wow.
Yeah.
Super cool.
Yes.
So we were talking about menopause and menopause makeover. So what's your approach to menopause makeover?
So yes, so post menopause. Back in the day when our parents were alive, menopause is kind of like the end of it all. Now it's just the beginning, in my opinion, when we're just peaking in our careers, we're peaking in our health, in our sexuality. Our kids are older now, so now we have more time to ourselves, more time for our careers, more time for our spouses. So it's really the me time.
Hmm.
So, and like, I know that my age now, almost 55, like, I remember my mom not being as robust as me, I guess, when she
Yeah.
was the same age. So there's a lot of things to the menopause makeover. We are now doing, the previous mommy makeovers that were for like women in their 30s. Now we're doing menopause makeovers, which can be anywhere from facelifts, neck lifts, eyelid lifts, but women also want perkier breasts. So we can do also less invasive fat grafting, like we talked about, not necessarily implants. The other thing with women post menopause, they no longer want the really perky fake breast look.
Hmm.
Like they did in the 20s. So
Right.
they're at this age, they're opting more for actually, let's remove my implants. I don't really like them that big anymore. Let's do a little bit of a breast lift and let's put some fat. And women are really opting for more natural breasts at this stage in their life. They
Hmm.
want a little bit more skin tightening, and they want a little bit more voluptuous, not voluptuous, but more athletic looking bodies. So maybe we do mini BBLs or mini Brazilian butt lifts with fat grafting again. So yeah, so the options are endless for menopause makeovers.
Yeah. And I love that.
Yeah.
The idea that, women are kind of stepping into their own and into their like peak at that age. So
Yes,
and
absolutely.
finding
And
ways
and
to
then there's
support them.
also a lot of like non-surgical modalities that go with this, that's more about wellness and sexuality. We can talk about like bioidentical hormones with
Mhm.
testosterone supplementation, estrogen and progesterone supplementation. It's just, and really sexual health, like postmenopausal. We talked about the regenerative therapies. Those can be applied in the female genitalia as well to enhance sexuality and improve genital health for improved sexual health.
Well, so the regenerative, you're talking about the plasma and the
That,
exosomes. Yeah.
that's correct. And the PRP as well, and
The
fat breath.
PRP.
Yes,
Okay. Oh, all of it. Okay.
yes, yes. And it goes for both men and women. So it's about having a good sexual relationship with your spouse in post-menopause.
Yeah. Yes.
Yes.
All good stuff.
Yeah.
So if someone was coming to you saying, I don't even know where to start, what would you recommend?
In my practice, we have a very non-intimidating consult room, I would say. We
Yeah.
have a white leather couch with pillows and blankets. I have a full-length mirror with like little lights on it. And so I just start the conversation with, well, you're already a beautiful woman, obviously. What would you like improved? And so we start with looking in the mirror, and then it's just kind of like chatting with their girlfriend. So it's
Hmm.
not like intimidating. And no one wears like white coats in the in the office, so it's not like there's the Dr. Fear, the white coat syndrome.
Right.
So none of that. So it's just like about chatting because it's just very personalized. This is their time to tell me what they like improved. And then as a plastic surgeon, I can tell them what's possible, what combination therapies work. I ask them about, well, how much downtime do you have? Because nowadays too, we're all so busy. Everyone's always traveling, working, family time, spouse time. No one really has time for downtime. So the biggest sellers are the more minimum downtime. And
Mm-hmm.
so just kind of depending on their goals. And then usually, is there an anniversary? Are you trying to look like a certain way before your wedding anniversary or your
Right.
child's graduation? So or a wedding, like a lot of bridal moms, come to me before the wedding, and they want to look better for the wedding. So that kind
Yeah.
of stuff. So it's really fun. So it's really all about getting to know the patient, getting to know where they are in their life and what they would like achieve. And it's about empowerment. Like plastic surgery, it's not vanity, it's empowerment. Because we're living longer, we want to live our best life. We want the inside to match the outside. And
Mm-hmm.
so we're not only just about the outside, that's why we bring in wellness in my practice too, because I want them not only to look good, but to feel good and to have good sexual relations with their spouses, that kind of
Yeah.
thing.
Yeah, for sure. It's definitely all connected.
Yes.
So if someone wants to do something like with minimal downtime, what do you think the top treatments would be for someone who just wants to try something out, doesn't want huge downtime?
Yes,
Um,
definitely. So it's all about plasma technology. The number one request right now, especially after menopause,
mhm.
especially about, this GLP-1 weight loss craze,
Yeah.
we now have hashtag Ozempic body and hashtag Ozempic face, which
Yes. Right.
pertains to the skin laxity that occurs after weight loss and
Yeah.
aging and menopause. So I would say the number one would be plasma technology. So Renuvion is a helium RF plasma that's a small little tip that we apply under the skin. It could be done on the face, it could be done on the neck, arms, tummy, thighs, anywhere we want tightening.
Mm.
So with small incisions, pretty much almost scarless, it could be done anytime we do liposuction to do extra tightening of the skin. So
Hmm.
that would be the number one because it's less downtime. It's minimally invasive. You don't need general anesthesia for it. A lot of times you could do with local anesthesia. I would say that would be the number one. Then the second would be the Neogen. That's the external nitrogen skin resurfacing plasma. So that can also be used on the face, neck, and on the body. So I do what's called a plasma sandwich technique where I combine these modalities. So to get the best result, I use the Renuvion underneath the skin to tighten it up. And then on top, we can safely apply the nitrogen plasma for more tightening and more resurfacing. And a lot of times with that kind of plasma sandwich technique, there's no huge incisions, there's no sutures, there's no scars, just tiny little poke holes. So that would be probably my number one recommendation if somebody doesn't want downtime.
Yeah, great. Well, that's very exciting. Just as we're kind of coming to an end, do you have any sort of advice for the listeners in terms of just your overall approach to management or something that you think they would want to hear from you?
So, my best advice would be to live your best life. I think part of living our best life is looking our best and to not be afraid to, plastic surgery, but whether it's surgical or non surgical, sometimes it gets a bad reputation. But there's so much to it that it's really about empowerment and confidence. I would say the best things that I hear from my patients talk about stories. I have this really cute 86-year-old woman, and I did the whole facelift for her, fat grafting and resurfacing, and she looked tremendously better. She looked great. At 6 months, she's like, "Well, you're so happy." So the staff asked her for a review, right? We all about the Google review. And
Yeah.
she's so cute. She's like, "I don't know how to use the internet, but can I give you a card?" And what she said, this is the best. She said, "You made me feel seen. What
Mm,
happens when you get old is you become invisible." And this is goosebumps.
yeah.
"You made me feel seen, that I'm relevant again, that I'm a woman again, that I'm an individual again." And so I think that was one of the best things that a patient
Wow.
has said to me. So yeah, so all of this is really confidence and empowerment and being seen and living your best life.
Yeah.
So I think, and I highly, highly suggest, work life balance. Like, we want to look our best on the outside, we want to be as healthy as possible, but enjoy your life too. Like, don't work too hard, travel, drink good wine,
Yeah.
all the good stuff. Yeah.
Yeah. Yeah, exactly. Like we work so hard, we want to enjoy our life. We want to
Yes.
get all the benefits
Yes.
and um, there's no point in doing all this if we're miserable. So
Absolutely. Or if we're not taking care of our health,
yeah,
yeah,
not
that's
taking care of
that's
our
the main
health.
thing. Or spending time with our friends and spending time with our families and our spouses.
Yeah, nurturing our relationships, people we
Yes,
care about. And
exactly. Yeah.
yeah, but that message from that woman must have just really inspired you to keep doing what
Yes.
you're doing as
Yeah.
well.
Yes, exactly. And just one last story, another one that's
Yeah.
really cool story. Like, I saw another patient, and she had a parotid cancer on the left side of her face, and she had a big surgery. They had to remove the parotid glands, they had to reconstruct her with a free flap from her forearm, and her whole face was radiated. So she saw me and she said, "I just want to look better. I want this side to look a little better and look more symmetric with my right untreated side." I'm like, "Okay, well," so I could not do a traditional facelift on her because of the radiation. So it's not safe to do, because there won't be any safe planes to do the facelift. So I
Mm.
did the regenerative therapy, a lot of fat grafting, and I did plasma resurfacing to improve her skin. When she was all healed, the best thing she said to me was, "Wow, now my husband is taking me for a romantic dinner out on Saturday night."
Mm,
So that was another like compelling like comment, because
that's yeah.
now she feels confident to be out to a romantic dinner with her husband again, versus before she didn't want to even go out. So yeah,
Wow.
so it's really about quality of life.
Yeah, it sounds like she felt like she just felt good. She felt sexy. She felt
Yes,
like
yes,
she
yeah,
wanted to be out there and just
yes,
be enjoying and living her life.
yes, exactly.
Yeah,
Yeah,
that's a great story as well.
thank you.
I'm sure you have many more, but yeah, it's just amazing. Like, as you said, it's not just about how you look, but it changes how you feel, how
Yes.
you live your life, how you present yourself. And
Yes, exactly.
yeah,
Yes.
yeah, amazing. Well, I love that story, and it was so great to talk to you and just hear about all the things you're doing, all the exciting advancements that are coming, or that are here, I guess, for women and men who want to make some changes, as we said, just about, you know, living our lives as best as we can, feeling
Mhm.
good, looking as good as we feel.
Yes, absolutely.
Well, how can people find out more about you if they want to reach out to you and connect with you? What's the best way for them to
Yeah.
learn more about what you do?
Yes. So my Instagram handle is at Dr. Face Rejuvenator.
Dr.
And,
Faith.
or
Okay.
they can call the office. It's at 941-954-4500.
Okay, great. Thank you. And we will add the information to the show notes. So
All right. Thank you so much. I appreciate it.
thanks, Melinda. That
With
was
you. Yes.
really, really great to
This
connect.
was a lot of fun to talk about all the positivity.
Yes, yes.
Yes.
Thanks so much. Bye.
Thank you. Bye-bye.
That's it for another episode of Essential Wellness. If you are enjoying listening to this podcast, please subscribe, like, and share with others so everyone can find us. See you next time.